How to protect yourself from the coronavirus. Number 1. Know how it spreads. There is currently no vaccine to prevent coronavirus. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person, between people who are in close contact with one another, through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Number 2. Take steps to protect yourself. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Put distance between yourself and other people if the coronavirus is spreading in your community. Number 3. Take steps to protect others. Stay home if you are sick, except to get medical care. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the trash. Immediately, wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. If you are sick, you should wear a face mask when you're around people and before you enter a healthcare provider's office. If you're not able to wear a face mask, then you should do your best to cover your coughs and sneezes, and people who are caring for you should wear a face mask if they enter your room. If you are not sick, you do not need to wear a face mask unless you're caring for someone who is sick. Face masks may be in short supply and they should be saved for caregivers. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. To disinfect, most common household disinfectants will work. Use disinfectants appropriate for the surface.